Hi, and welcome back to the second part of this course of Infection Control Principles and Isolation Precaution Practices. In this section, we will be discussing isolation precautions, including standard precautions and transmission-based precautions, and the standards and requirements for each of these types of precautions, and the use of the personal protective equipment that goes along with each of the types of isolation precautions. What are standard precautions? Standard precautions, previously known as universal precautions, are the basic level of isolation precautions. The purpose of standard precautions are to reduce the risk of transmission of blood-borne and other pathogens from recognized and unrecognized sources to a susceptible host. They include hand hygiene, use of personal protective equipment, respiratory hygiene and cough etiquette, and safe injection practices. Transmission-based precautions. Transmission-based precautions are additional infection control precautions used for patients who are known or suspected to be infected or colonized with infectious diseases. These precautions are based on the route of transmission of the microorganism. They build on standard precautions and include the use of hand hygiene, personal protective equipment including gloves, gowns, and masks as needed, and the placement of the patient into a private room. Contact isolation is used with patients with microorganisms known to be transmitted through direct or indirect contact with the patient and their environment, and include the use of PPE. Droplet precautions include the use of surgical masks within 3 feet of a patient due to large respiratory droplets. Airborne precautions call for airborne infection isolation room with negative room air pressure relative to corridors, air exhaustion directly to the outside or recirculated through HEPA filtration with 6 to 12 air changes per hour. Personal protective equipment. Because unsuspected infectious agents may be present in blood and all body fluids except for sweat and on non-intact skin and mucous membranes of all patients, hand hygiene and personal protective equipment, including gloves, gown, mask, eye and face protection, should always be used if contact with these substances is likely. Personal protective equipment serves as a basis for standard and transmission-based precautions. There are recommended procedures for donning and doffing PPE. Please find below the link for a YouTube video that demonstrates the proper procedure for donning and doffing personal protective equipment.